I'm Brian Shaw, Certified Diabetes Educator here at Sacramento Native American Health Center. That means I talk with patients about what diabetes is, help them understand a little bit more about their medications and their diet and exercise so they can live a healthy life. Today in our next series of videos, we're going to talk about proper injection technique for liquid medications. That can include insulin. It can also include something called Victoza, Bydureon, or Trulicity. All of those are liquid medications and they all do slightly different things. But today we're going to talk about how to inject insulin primarily. The number one thing you should consider is before you leave your doctor's office and before you leave the pharmacy, make sure that you understand, number one, how much medication to take, number two, when to take it in the day, and number three, what some of the possible side effects are so you can watch out for those. Other than that, we're going to talk about very basic injection techniques for both a pen that has liquid in it as well as a syringe and vial that has liquid in it. Let's take a look at some of these pens right here. All of these pens have something in common. They have liquid in them, and they also have a window here that tells you the dosage. The dosage is the amount of units or the amount of liquid that you're going to inject into your body when you're ready to do it. And the window basically tells you when you dial it up what dosage to go to. Your doctor will tell you what dosage and what time of day to inject. All of these pens, when you take off the cap, they have liquid. It's usually clear inside, and then there's what we call a plunger. The plunger tells you how much liquid you have left because as you inject over the days, the plunger will move the direction toward the end of the pen, and then once the plunger gets to the end of the pen, you'll see you only have about a dosage or so left to go. Make sure that you use all of the liquid in the pen and make sure that you are prepared for the fact when you need to have a refill done. So each pen has what we call a window. It has the written dosage in here and a number. You can dial it up and dial it down based on what your dosage is, and then there's a button at the end. When we're looking at a vial of usually insulin, it comes along with syringes. The vial will have liquid in it. You should also check to make sure you know how much to give yourself and at what times of the day. And the syringe will have markings along the side that tell you how much dosage to use. You can pull up the dosage in the vial when you're ready to go. What you should remember first of all is before we actually inject, how to store the medication. Pens can be stored in the refrigerator at refrigerator temp. A vial can also be stored in the refrigerator. When you are using the pen that is the current one, in other words, the one that you're using, getting the liquid medication out of, this can be stored at room temperature. Not in a hot car, not in a hot bathroom, but room temperature, somewhere between 70 and 75 degrees. Vials of insulin can also be stored at room temperature, although you can store them in the refrigerator. Once the vial has reached 28 days or the pen has reached 28 days, you need to throw them out and you need to start a new pen or vial of medication. So let's talk about proper injection technique. Each of these pens are for a different kind of liquid medication. This one right here is for Lantus. It's gray. It may not always be gray. This one here might be for Basaglar. It may not always be blue. Some of the medications are for rapid-acting insulin. They may be a different color of pen than the long-acting insulins, which may be a duller color of pen. Just make sure you know which one is which and that you're using the proper one each time. We're going to use one that may be like Basaglar. You're going to see in the window here that the dosage is in a number. So what you're going to want to do first is take off the cap, make sure you have enough liquid medication in the vial, and then take what we call a pen needle. A pen needle will come like this. It may have a different color, but it'll have a wrap on the end of it that you pull off like that. Do not stick your finger in there or else you will poke yourself. Take the pen needle and screw it on the end of the pen until it's tight, until you can't screw it anymore. And now you've got the pen loaded and ready to go with the needle. You've got an exterior cap that you just pull off and put to the side. Then you have the interior cap so that when the exterior one is pulled off, you're not poking yourself. Keep that one on until you're ready to go. And then when you are ready to inject, what you do is you dial up the dosage according to what your doctor says. So we're going to dial it up, in this case, to 10 units. We're going to give ourselves 10 units of basal insulin. So we're going to dial it up to 10, 10. If you make a mistake, if you go beyond 10, or if you don't go enough to 10, you can just dial it up and dial it back. There is no harm done in going up or back until you reach the right dosage. So now we are at 10 units. I would make sure that you don't touch the button at the end of the pen until you're absolutely ready to go. So we are ready to go. We've dialed up the dosage. We have the needle on the cap. Now what we're going to do is we're going to prepare our skin for injection. Now that we've dialed up the dosage in the pen, we're going to talk about which areas of your body you can inject the liquid medication into. The most common areas are here in the stomach. This is where the most fat usually accumulates in people's bodies, and so this is a good area to inject insulin into. You can also do it in your thighs or in the back of the arm, although both of those locations require a little bit different of a coordination to make sure you get the needle in directly. So today we're just going to do it in the stomach area. Choose an area of your stomach that you haven't recently injected into. If you do it multiple times in the same area, you can develop scar tissue and then the liquid doesn't get in entirely. So choose an area of your stomach that you haven't done it recently in, or rotate. I'm going to use this pad just as an example today. You can use an alcohol swab, or you can just get out of the shower, it's fine, just as long as the area is clean. Open up the alcohol, clean the area that you're ready to inject into. We can let it dry a little bit. And then once you're ready and you've dialed up the dosage of the medication, in this case we have 10 units of Basaglar that we're going to inject, what you do is you take off the interior cap, and you can see this pen needle is not very big at all. It's tiny, 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 tiny. So we have the part of our stomach that is bare. We've got the pen needle dialed up with the dosage. We've got the insulin pen dialed up with the dosage. We have the pen needle ready to go. I would hold the pen as if you were going to stab it with your thumb on the button, although don't press the button quite yet. You're going to want to go in at a 90-degree angle that is straight in to your stomach, and when you're ready to go, you're going to push it in until the needle stops, and you're going to press the button at the end of the pen, and then you're going to count to 10 to make sure that all of the liquid gets inside your body. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Making sure all the liquid gets inside. Pull it out, and then with the external cap, what you do is you put the outer cap back on the pen. You unscrew it. Now you've got the pen without the needle cap on it anymore. You put it in a sharps container. You can put the cap back on the pen, and you're ready to go. All right, next we're going to talk about injecting insulin with a vial and a syringe. So you can see right here we've got a vial and we have a syringe. The syringe has markings on the side of it that tell us what the dosage is, and the vial is almost full of insulin, although there is air at the top. So what you're going to do is you're going to decide what the dosage is. Again, check with your doctor or check with the pharmacist to make sure you know the dosage and the amount of times per day. You are going to use that dosage and pull the plunger of the syringe down until the line hits the dosage. So for example, we used 10 units last time. We're going to do 10 units again. We pull the plunger of the syringe down to the 10. Make sure it's right at the line of the 10. Right? And now you see that you have 10 units of air inside the syringe. That is the very first step. You don't actually push the syringe into the vial when it's at 0. You pull it out to the dosage that you're going to take first so that there's air. Pull the cap off of the syringe, and then you've got the vial upside down. Note that there's a rubber gasket or rubber cap on top of the vial. What you do with the 10 units of air that we're going to inject is you stick the needle of the syringe into the vial. You've got 10 units of air, and you're going to displace 10 units of air into the vial and pull 10 units of the liquid out. Okay, we've just displaced 10 units of air. Now we're going to pull back to 10 units of insulin. Okay. And then what we do is we pull it out of the vial, and we just make sure that there are no bubbles at the top. If there's bubbles, you can kind of flick the end of the syringe. Now you've got 10 units of insulin ready to inject. Now, like we did with the pen needle, we're going to use the syringe to inject insulin into our stomach. Again, take a clean area of your stomach, one that you haven't recently injected into. Clean it off with alcohol or just when you're getting out of the shower, making sure that it's dry. You have drawn up 10 units of insulin, or whatever your dose is, into the syringe. you've got the cap off of the syringe, and now you're ready to inject. Again, my suggestion would be to hold it as if you're going to stab, either with your index finger or with your thumb on the top of the plunger of the syringe. And then just go straight in when you're ready, straight into your stomach until the needle stops. Push the plunger all the way in until it stops. Count for a few seconds because you've gotten most of the liquid already in there. You can pull it out, and then when you're ready, put it in the sharps container, and you're done. All right, so in summary, we have injected both from a pen and a pen needle, as well as a syringe and a vial. So the number one thing I want you to take away from this is how do you inject, whether it's with the pen or the syringe and the vial. Also, I want you to remember, what is the dosage that you have to take? Check with the label on the box that the pen or the syringe and vial come in. Check with your doctor and check with the pharmacist to make sure that you're taking the right amount of the right kind of medication at the right time of day. Make sure that the vial, any unused vials are stored in the refrigerator. Any unused insulin pens are stored in the refrigerator, but the one that you're currently using and taking from can be outside at room temperature as long as it doesn't get too hot, not in a car, not in a hot bathroom. Make sure it's at room temperature, and making sure that you are dosing yourself with the proper dosage by dialing it up in the window or pulling it down with the amount of air corresponding to the dosage first before you put it in the syringe, displacing the air into the syringe and getting the right dosage, and making sure that you're going on a part of your body that you haven't injected in more recently. That concludes our discussion today of proper injection techniques. Thanks for joining us. Please join us next time when we cover more about different types of injectable liquids, what they do and how to do it. But for now, I'll see you next time. Thank you. Bye-bye.